Hello, I am Dr. Nachiket Dubale. I am a consultant gastroenterologist working in Poona hospital. I have an experience of around 10 to 12 years in this field of gastroenterology and therapeutic endoscopy. Today we'll talk or discuss about a very common GI problem, that is gallstones, that is stones in the gallbladder. So we get a lot of patients who come with the report of sonography who has mentioned that there are some stones in the gallbladder. How important is to deal with these stones, whether the treatment is required or not, or we should treat them medically, we should treat them surgically. So these things we'll discuss in a very short time. So gallstones are basically diagnosed when anybody who has any abdominal symptoms goes to investigate and does a sonography, and the sonologist or the person who does the sonography picks up the stones in the gallbladder. That's what the usual way of diagnosing these stones. Many patients, almost 80 to 90% of patients, are not having any symptoms because of these gallstones. Acidity, bloating, constipation, diarrhea, these are not the symptoms of gallbladder, which I want to emphasize. What you should recognize as a patient is pain in the abdomen, especially in the upper abdomen or right side of the abdomen, which comes suddenly, which comes maybe after you eat a heavy meal or in the middle of the night, and it lasts for about 2 to 3 hours and it goes down on its own. These are the main symptoms of gallbladder stones. So pain is the predominant symptom of gallbladder stones. So what are the things you should be looking for, whether the pain is going on its own or not? If the pain persists for a longer period, then probably we are dealing with some complications of gallstones. So I would recommend that everybody knows about these symptoms, and then once you have the diagnosis of gallstones, see an expert or a gastroenterologist of your choice and get the proper consultation. I would like to tell, not all gallstones require any surgical or medical treatment. In fact, the medical treatment is not so effective. Anybody who claims that we can dissolve these gallstones is not true and should not be indulged into such kind of treatment. The treatment for gallbladder stones is purely surgical, but that decision has to be taken by an expert and not by anybody else. So I would recommend that everybody who has these symptoms would concentrate on the symptom I told and then get treated. So what are the complications of these gallbladder stones? The most important complication is the swelling of the gallbladder. When the pain does not go away or patient has fever, then we should suspect this. Sometimes there is pus formation in the gallbladder. We call it as empyema of the gallbladder. Then immediate surgical treatment or some drainage procedure is required. Sometimes the stone can come into the bile duct from the gallbladder. Then of course we as endoscopists remove those gallbladder or bile duct stones by an endoscopy, and the surgical treatment will be followed. Sometimes a severe complication of gallstone related pancreatitis can happen, which can lead to sometimes very severe disease, and a patient needs to be required to be admitted in ICU, etc. So my dear friends, I would recommend that you should not ignore the diagnosis of gallbladder stones. You should take immediate expert opinion, and then according to the symptoms you should get treatment. As I told earlier also, that not all gallbladder stones do require treatment, but who have symptoms should get treated as early as possible. So this was about the gallstones. If you have any queries, you can write down in the comment section and we'll try to answer most of the queries. Thank you.